Welcome back. My name is Dr. Carl Baird, and today I'll be showing you how to perform two different variations of the single arm kettlebell deadlift. This is a great exercise to help improve unilateral stability, as well as improve any side-to-side muscle imbalances that exist that can lead to more impact on your joints and contribute to joint pain as you get older. It's also just a fun exercise to challenge yourself in a different way. So let's start with what would be called the traditional single arm kettlebell deadlift. And so to perform this one, the kettlebell is going to be on the inside of the foot. So we're going to put that kettlebell right on the inside of the foot. Just make sure that it's not in front of the foot. You don't want to be reaching for it that way. From there, we're going to perform this movement like we would with the kettlebell deadlift. And we're going to send our hips back, keeping that neutral spine. And again, once we can't go any lower without rounding our back, then it's okay to bend the knees until we can grab the weight. So in this bottom position, I'm focusing on keeping my chest up, keeping my hips down and engaged. And from there, I'm going to press up through my feet to stand up. So again, to set it down, send those hips back, keep that neutral spine, and then bend the knees. The kettlebell should be moving straight up and down and shouldn't be traveling forward. So let me just show you a couple repetitions. There, and up, and down. So that's the traditional single arm kettlebell deadlift. The other variation is the suitcase variation. So to perform this one, the weight is going to be on the outside of our foot. Again, we still want it close in. We don't want it too far in front. But now I'm going to be sending those hips back, then dropping them down. And from there, I'm going to be pressing the feet up and coming up. So it's more like a suitcase carry at the top. To set it down, it's sending the hips back and down. Now, if you have to choose one, this would probably be my preferred. If you're somebody with joint pain, it's a little bit safer, a little bit easier to perform, and it targets our core just a little bit more, which is really important for protecting your lower back. So give those exercises a try and let me know how it goes.